Good morning, everybody. Good morning, Madam Administrator. Let me know when you are ready. So good morning, everybody. We're going to start our public hearing on the Tobacco Trust Fund. And I know that people are just popping in, so you'll see a bunch of people pop online, a bunch of people pop in person. Representative McCarthy Vahey, do you have anything to say?
Just thank you and looking forward to the discussion.
Senator Berthel?
Good morning, Madam Chair. Good to see you. Looking forward to the discussion as well.
Representative Nuccio?
Thank you, Madam Chair. Just, yep, happy to be here and very anxious to get to the conversation.
Senator Summers, are you on? And Representative Claritas Detria?
She's going to be jumping on late, Madam Chair.
Thank you. And Senator Anwar is taking care of patients, is my understanding. And Representative Walker is here, but she'll be in the room in a few minutes. I think that's everybody. So we're going to pop right into it. Commissioner Jitani is up now. Commissioner, we know that you have someplace to be, so the floor is yours.
Thank you very much for the opportunity to testify to you today. And I want to thank the Public Health and Appropriations Committees for this opportunity to testify on the Tobacco and Health Trust Fund Board's allocation plan for fiscal year 24. So tobacco use remains the leading cause of preventable death and disease in the country, and specifically in Connecticut. Tobacco-related healthcare costs are roughly $2.36 billion every year, and approximately 4,900 Connecticut adults die from their disease related to their own smoking. And currently, the rate of cigarette smoking in adults is 8.4%. This is down almost 50% since 2011, when it was 17.7%. However, e-cigarette use has also gone up in roughly the same amount of time. So since 2013, it was at 3.7% and up to 6.2%, so roughly doubled in that period of time. And among Connecticut high school students, tobacco use in the last 30 days from one of the health surveys that we do has been reported at approximately 12.7%. So our proposal is to use CDC percentage allocations to 5 different components, which have been shown through evidence to be able to have their greatest impact on reducing smoking prevalence in the community. And the 5 different areas that these include are state and community interventions, number 1. Number 2 is health communications. Number 3 is cessation interventions. This is the biggest percentage of what we are requesting. And the Connecticut Quit Line is one of the major sources of funding that would be received in terms of these cessation interventions. The 4th is surveillance and evaluation, which in large part DPH does to evaluate how programs are working and surveying the data. And then lastly, infrastructure administration and management. And again, this is really to support the DPH programs that are able to help do that. So as I mentioned, I wanted to specifically just comment on the Connecticut Quit Line, which is free and tailored 24/7 cessation services. And specifically between January of 2020 and July of 2024, they assisted 8,523 tobacco users. And we're looking to add services targeting specifically youth and postpartum women. Success of the Quit Line includes a 37% quit rate and 90% satisfaction rate so far. And as I mentioned, it has been very successful in terms of being able to help reduce the number of active smokers, but we still have work to do. And we specifically also have to look at the changing dynamic of where tobacco use and e-cigarette use is in our state at this time. So, for example, the current rate of EVP or electronic vapor products in Connecticut is 11.5%. This is nearly 4 times the prevalence of cigarette smoking, specifically in youth. So if we specifically look at youth patterns of behavior, this is something that we are intently aware of and really are trying to focus some efforts on. And nearly 3 out of 10 students who use EVPs say that they use it daily. So 30% are saying they're using it on a daily basis. So I just wanted to also share that we've had a request for proposals that did go out, and that release date was September 12th. We received 17 proposals, and they are currently being reviewed and will be evaluated by the end of November. So our request for the budgeting of all of that is in front of you in my written testimony as well, and I'm open to any questions you may have.
Thank you very much, Commissioner. I would remind everybody that the commissioner has to be someplace. So if you have questions, I do have a couple related to usage amongst the youth population, which I'm assuming is under 18, or is it under 21?
The youth is under 18. Actually, I believe it's up to, it is for those who are in high school. So because that's where the survey is administered.
And so it could possibly be up to 21 if they are.
That's true. Yes. Depending on who, yes.
Who the person is.
Right.
So has there been some look at that population related to the use of tobacco, related to the use of mental health? Because I believe it's pretty well known that in the adult population, the use of tobacco products amongst people who have some mental health issues is higher as a calming mechanism. Is that something that's happening amongst youth, or is there no survey relative to that?
No, you're exactly on point. And in fact, our survey results show that. So we have something called the YRBS, or the Youth Risk Behavioral Survey. That is what is administered in high schools. And in fact, what it shows in terms of personal characteristics of those who are users is that those who have poor mental health as an underlying self-reflection of their own mental
Yep.
health do have higher rates of use.
And is there some look at, this is a question that I've had even amongst the adult population. Is there some look at figuring out the balance between those who need some calming methodologies and those who are using obviously a product that most people do not want to see our young people participating in? Is there some way to balance those two thought processes that happen?
I think it's an interesting question and a valid point, because I think what we're seeing is that the public health campaign to reduce tobacco use and cigarette use has been quite effective in terms of what we see the rates are in our younger populations. However, in the adult populations, what we see in our behavioral risk factor survey, which is more done at the population at large, is that there are some of the same things that you're talking about in terms of mental health challenges in adults, but many of the people who are trying to quit are in the older decades of life, in the fourth, fifth, sixth decade of life. That is often many of the people, and that's historically reflects where tobacco use exists in our state. So, I agree that there is a challenge around mental health. There are people that are still using it as a calming mechanism in the adult population as
Right.
well. But there has also been a transition to using nicotine products that may not be tobacco-based in some of the adults who are in their 20s, 30s, and 40s. And there are some who have transitioned from tobacco. And part of that, as you know, is some of what we help with too, in terms of nicotine replacement products, which can also help kind of in that trajectory to getting off of smoking and then potentially to nicotine and others.
And can you get us some examples of what nicotine replacement products may be? Because we hear concerns over vaping and some of the other things that young people may participate in, more to be socially accepted
Yes.
than mental health, but some of them may have a mental health component to it. So if you could get us an idea of what that would be, and would when we legalized recreational marijuana, we made it for over 18, but we all know that personally, I think drinking is the worst thing of all, but I have a personal hatred of alcohol use sometimes. But is there a movement away from tobacco into recreational marijuana?
So I think for that question, we may have some emerging data on that in terms of, as we have started to collect questions on cannabis use in that same youth risk factor survey. So we have a couple of years that are just starting to kind of be able to show us somewhat of a pattern. We may be able to answer that question a little more. We can get back to you with that. One thing I did want to just share as an example through the Quit line is, for example, in the time that we have been using the Quit line of recent in these last 4 years, some of the data that I shared with you, we've had 370 orders for combination nicotine replacement therapy, which have been shipped to participants. And that would include, as examples, gum, lozenges, patches. So those are just some, but we can get back to you with additional information about nicotine replacement therapy.
Thank you. Representative Walker, do you have any questions for the commissioner?
Good morning. Thank you.
Representative McCarthy Vahey?
Thank you, Commissioner. Thank you, Madam Chair. I'd also like to take the opportunity to thank you, the department, and Dr. Terranova, who's also been such a wonderful part of this work. The thing that I'd like to follow up on, and I really appreciate Madam Chair's questions, one is just Zyn and the role of that especially in our young people. And I know, that's not necessarily what we're talking about here, but do you have any data or any information on that, or any plans to to actually collect more data with respect to that product?
I don't have data at this time right now, but I think this is all we can get back to if we have any further information on this. But I think that we are entering some interesting times in terms of products that are coming onto the market. We've got vaping products that are tag teaming as gaming products. The more you smoke, the more points you get. These devices have opportunities to communicate with potential other users. It's becoming more and more of a concerning pattern in terms of the way that some of these products can be used. And so I think that's part of what we're going to be looking at closely as a department.
Thank you for that. And I think that's part of why I bring that up, is because the products tend to evolve, and we did adjust the law to be sure that we could have the conversations and use the funds for vaping, because to Senator Austin's point, this is a big part of what you're facing and what we're facing, and you certainly are sharing that data with us. My second question is related to the funding, which is a question you'll always hear about, and I'm looking at Claudio. I'll be asking him about this as well. When you began your remarks, you talked about the expenditure. It was a billion number.
Healthcare
mean,
expenditures over 2 billion.
Right. Yes. In other words, there was a B
Mhm,
behind it, not an M.
correct.
Massive. That's a massive number. And yet we are, and I will applaud us for making progress. And I want to thank the group for getting back to us, as was requested by Madam Chair at our last meeting. But now that the group is up and running and really, full tilt, do you think that if they had the opportunity, and I know we're going to be having some very difficult budget conversations this year, certainly in light of many different factors, if they had the opportunity, is it your opinion that they would be able to effectively and successfully deploy additional funds that could help us save money towards that billions, over 2 billion number?
The Department of Public Health always tries to use every dollar given to us to maximize the prevention efforts that we can accomplish for the residents of Connecticut. So every dollar that we get gets stretched to its full potential to make sure that we can reach as many people as possible. So as money is available, we will make sure to put it to its best use to attack that very staggering healthcare figure that you commented on.
Thank you for that. I know there's some research out of California that shows kind of the return on investment, and hopefully we can dive into that a little bit too. But thank you again for your work, and to the whole committee as well. Thank you, Madam Chair.
Thank you.
Thank you. Senator Anwar?
Thank you, Madam Chair. Thank you, Commissioner, for your testimony and the work that the DPH has been doing on this important issue. And this is very important conversation, especially because traditionally we have not done as good collectively as a state that we could have in the past many years, and American Lung Associations have given us a grade of F for not being able to invest as much as we should. So having this conversation is very important, and this is actually a new era where we are going to hopefully do better. Having said that, I know that there are some models. I agree with everything that you have said and your testimony. I agree with the current strategy, but I wanted to explore with you and perhaps Claudio as well later about industries that are part of the propagation of tobacco in our state, whether it starts from agriculture or beyond into the delivery mechanisms. And there are programs in other states that have tried to use retraining of the workforce, grants to be able to move away in that industry to try and reduce the delivery and the creation of some of these things. Any thoughts on that? And is that an area for us to look as an opportunity because it's worked well in some other states?
Yeah, I'm open to
Interesting.
looking at any successful model that has been identified in other states within the CDC framework of recommendations on where to allocate funds. This is just another that would involve state and community intervention as an example, or a cessation intervention. So, for this particular round, I think we have proposals that have come forward, but there are opportunities going forward that I would most certainly welcome evidence-based proven interventions that have worked in other states. And I'm happy to continue that conversation with you.
Thank you so much. And I think just for the record, it wouldn't be fair to say that this is, while it's tobacco-related conversation, it's also about nicotine addiction in other forms as well.
Absolutely. As my comments suggested in terms of the electronic vaping products, nicotine is harmful to our youth, and finding ways to help youth and adults not have nicotine as something that they need in their system is something that is the bigger overall issue that we're trying to address with this work.
Thank you, Commissioner. Thank you, Madam Chair.
Thank you. Representative Walker, followed by Representative Nuccio.
Thank you, and good afternoon. Great to see you. Great to see you. Thank you for your testimony. A couple of quick questions. I saw that as of July 24th, you have changed the service provider for CT Quicklime. Can you share any reasons why? Was something not, was the data not being collected? Was a problem in direct services on the Quicklime? I'm just curious.
So in terms of the actual vendor, we're now using National Jewish Health. That's who began in July of 2024. And I can get back to you with specific details on why that change had to happen, but there was some technical issue related to the previous vendor, and I can get back to you with more specific details on that.
So thank you. So then going on to the proposals that you have for investment options. These are investment options like the first one, state and community interventions. You've been doing that for 4 years, 5 years, how long?
Well, we have had CDC funds to do this type of work, separate and apart from the state funds. This work is going to be relatively new because we have been doing some of this work through other dollars that we have. But with this allocation, we're really making a renewed investment in this work. So to your question on the types of things that we've done with other grants that we have, for example, we have a program called Truths Initiative. This is quitting program, and this is for tailored cessation via text for people between the ages of 13 and 24. We've had 148 subscriptions to that service, 94 enrollments, and out of that, about roughly 40% are teens and 60% are young adults from that program. But that is, for example, that's from our CDC direct grant funding that we've received. But that's just an example of the type of program that we've had.
Okay, so I wasn't really looking at the funding. I was looking at just the different categories that you
Yes.
had. Of those, the categories that you have here presented, which one is the longest one that you've been investing in, and what is the shortest one?
I'm not sure I have right off the top of my head, which is the longest. What I can say is that all of these have had some commitment from the state for a significant period of time. But the cessation interventions, the third one, is the one that's really the work directly in the communities to try to help people quit. That's where the biggest intervention, I would say, is, but we've had mass media campaigns, whether directly from the CDC or from the state, which have directed people to the quit line for a long period of time. So these interventions have all been going on for many years. We can get back to you with exactly how long, but I would venture to say several decades.
I think what I would like to know is which ones have been successful that you were able to document, and which ones are new, and which ones are actually direct services to the people. I know we do a lot of marketing on a lot of things, because on the opioid committee, we do a lot of marketing there too. I think there's a place for that, but I think direct services tend to be a little bit more efficient in abstention with the population, both for cigarettes and with drugs. So that's why I'm in looking at some of the things that are here. There is marketing, but cessation is really the one that is a direct one-on-one. And I think that one, I think is very good, is that we need to look at our marketing and how long we've done the marketing, who's provided the marketing, who's been in the market, and how many are we able to actually document and say they came to us because of this thing I read on a bus, or because I mean, a lot of this is sort of posters and things like that. So that's what I was looking for.
Yeah, we actually do have a little bit of that, which is to say that, for example, 43% of participants recognized or heard about the Quit Line through DPH's Commit to Quit media campaign. So to your point, our media campaign, which is called Commit to Quit for Connecticut, 43% of people who went to the Quit Line heard about it through that media campaign. 57% heard about it through the CDC TIPS campaign. So that's the federal campaign, but they end up coming to us anyway. So they work in tandem, you know, and the media efforts are really driven largely to get people to engage with the actual cessation efforts. That's what the point of the media campaign is to leverage that.
Exactly. And that's why because I know whenever people get off and just before they get, they say, okay, excuse me, how did you hear about this?
Right.
And so we are doing exit interviews
Yes.
in these circumstances. Okay. Well, I'd like to, if you could send us the stats on that, that would be really, really helpful. Thank you. Thank you, Madam Chair.
Up next is Representative Nuccio, followed by Representative Welander.
Thank you, Madam Chair. So I'm kind of going to follow up a little bit on what Tony was just saying. I had a couple of things. First being, we talked about the decrease in smoking, and then the massive increase in vaping. And the numbers are pretty similar. So to me, that kind of means we have people that may not be smoking combustible cigarettes, but now they're vaping. So I don't know that I consider that really any kind of success for us if they're just going to a different delivery method of the caffeine. I mean, not caffeine, sorry, nicotine. So I was wondering if there's anything that we've been looking at for that, because as Tony was just saying, you know, if we've had some of these programs that we've had for several decades, and the cessation is the third on our list of 5-year priorities, and we're talking about a 33% quit rate, statistically, I don't think that's great, right? So I'm wondering what we should be doing that's more aggressive, especially in the younger school age children, to get them to not vape and not smoke. So I was wondering if you could maybe speak to that a little bit.
Sure. Thank you for the question. So a few things I would say, first of all, is that I would offer that moving from tobacco to vaping products, as you said, is not ideal. However, tobacco causes lung cancer. And so I think going from one to the other is not ideal for sure, but in terms of reduction of risk, at least in terms of direct lung cancer from tobacco itself, that is still, you know, a positive. But I fully agree. I don't underestimate what you're saying in terms of the risks of vaping and nicotine itself. Secondly, I would say that, you know, we have not had this type of investment from the Tobacco and Health Trust Fund in many, many, many years in Connecticut. What we've been doing is using a separate CDC grant that we have to be able to do the interventions that we have. So I think what remains to be seen is, with now this renewed state investment in this type of work in our communities, we will be able to see the potential benefits more so. And I think that's what we are really looking forward to, and really commend everyone for being able to help get us here at this point.
So that kind of gets me to my next thing. I agree with you, right? Since I've been in the legislature, I've been yelling and screaming about the fact that we get this money, these millions and millions of dollars, and we have not been spending it. We haven't been using the board, and we haven't been spending it, in my opinion, in you know, an adequate way to kind of prevent or cease people from smoking. So I've always been a huge advocate of this money going to where it should be, which is exactly to the Department of Health to create these programs and to have the smoking cessation programs and get more education into the school system. So the 12, I believe it's what, $12 million that you guys are allocating here. Do you feel like that's an adequate number? And do you feel like it's an adequate share of the money that the state gets between the trust fund payment and the taxes that they receive for the sin tax of smoking and such to adequately reduce this number down?
This is an investment that we have not seen for a very long time. And I think with this first investment, we will start to see what outcomes we get. And that will help provide more information to the legislature, to the executive branch on where the value of that investment is and how we see the outcomes evolving in our community. And as I said to Representative McCarthy-Vahey, our goal in the Department of Public Health is to put every dollar as far as we can, and we will do that.
Well, I look forward to having you up here advocating with me for that money from the trust fund to go where it should go and not be dumped into the general fund. So hopefully I have an ally in this now.
Thank you for that comment, Representative Nuccio. Up next is Representative Wieslander.
Thank you, Madam Chair. Good morning, Commissioner. Yeah, still morning. My question actually touches base on what Rep. Nuccio was just talking about as well. As the parent of 3 teenagers, I'm very concerned about the use of e-cigarettes and vaping with our young people. And what you just mentioned, I was wondering if we could expand upon that, because I feel like there is this current perception that vaping is quote unquote less dangerous and less harmful than smoking combustible cigarettes with nicotine. And my posit is that we haven't seen the long-term data on this yet. And that we are going to be seeing, I think, younger people with chronic conditions, asthma, lung damage, COPD, coming up in high numbers soon, because they are using it at a much higher rate. So I was wondering, with that in mind, the plan for cessation and prevention, how much of it is going to be integrated into our school systems? And exactly how are we going to be targeting young people to make sure that they understand there are some very, very serious damages that can happen from this usage? Because I know from talking with my kids, there are students or classmates that are using them in the schoolroom. Their teacher steps out and the kids are vaping, and there's secondhand effects of this as well. So that's my sort of long-winded question about how we can keep our kids safe.
Absolutely. And thank you for that question, because to be explicitly clear, the harms of vaping are real. There is no underestimating that just because they're not using tobacco, that vaping is okay. It's not okay. And I completely agree that we don't have enough data or enough time for us to be able to really fully understand what the impacts are going to be long-term. Having said that, I think both the state and community interventions where we're looking at strategic planning, bringing the various groups together, making sure that we're coordinating community-based efforts and interventions that can be integrated within schools, within classes, health classes and the like, and then making sure that those cessation interventions also get in there. These percentages and this framework has been well documented to have gotten us where we are now from even the 90s, let's say. Now, I understood what was said earlier about, well, just because we're not smoking and now maybe it's vaping, you know, there's been no change. I think it is still progress, and it's worth recognizing the progress that many young people are not going towards smoking. It's not good that they're going towards vaping. That's dealing with the underlying challenges that our children are facing, and they're looking for some outlet. But that public health campaign has been effective. So I think we can do the same thing with a very targeted and focused and committed approach, while at the same time dealing with the real mental health challenges in terms of why they're getting there in the first place.
Thank you so much for that answer. Thank you, Madam Chair.
Thank you. Up next is Representative Dillon.
Thank you very much, Madam Chair, and good morning, Commissioner. Thank you for your work. I realize that there is some focus on postpartum, but on the under 18 population, do we have information in Connecticut on gender differences, either in the distribution of the youth or whether there are some interventions that may be more helpful with one gender than another to delay the first use of tobacco or vaping?
What I can share is that female high school students had a tobacco use rate of 13.9%, which was higher than for their male counterparts, which was 11.2% in our most recent youth survey. So in terms of interventions that work better for our young girls versus boys, I don't have specific data on that, but if we have something, I can make sure we get that and get it back to you.
Well, I'm going to look at what you have. That's alarming. For some reason, I thought it was the opposite, but that's why looking at data is so important. Thank you. And thank you, Madam Chair.
Thank you. I think that's it, Commissioner. You're free to go to your next event.
Thank you so much.
Representative McCarthy Vahey, you said a comment you wanted to make so that people would have that as they go into the next round of comments and questions.
Thank you, Madam Chair. Just to note that the Department of Mental Health and Addiction Services does provide tobacco prevention funding through the local prevention council grants that go to each of the 169 communities. That work is in concert with the work of the Department of Public Health. Just wanted to share that. Thank you.
Thank you. Up next is our Senior Policy Advisor, Claudio Gualtieri.
Thank you. Good morning, everyone, distinguished members of the Appropriations and Public Health Committee. You have my written testimony, and I am Claudio Gualtieri, Senior Policy Advisor to the Secretary, here in my capacity as Chair of the Tobacco and Health Trust Fund. In addition to the written testimony, I thought it would be helpful if I summarize for you some of the quick overview of the Tobacco Board itself and our current iteration, and talk through some of the highlights of the FY24 plan before you today. Before I start, I'll note with deep apology that there are 2 small typos in the allocation plan on page 11. While all the funding amounts are accurate in our allocation chart and each of the headlines is accurate, in the narrative on page 11, the administrative costs and the surveillance and evaluation are mistyped. So there's a typo on the first line under each category. So my apologies for that, but substantively, the budget and the each headline is correct. So with that, I'll start with a current overview of the board. The current iteration of our Tobacco and Health Trust Fund Board was reestablished by Public Act 22-118 with the infusion of $12 million of tobacco settlement funding to be used to reduce nicotine and tobacco use in the state of Connecticut through a variety of means, including education, prevention, and cessation programming. The fully reconstituted board began meeting in late spring of 2023 when we reached the requisite number of appointees to constitute a quorum. In Public Act 2392, with the good partnership and leadership of our public health colleagues, we ended up taking a refreshed look at the board's priorities and statutory authority. In particular, we codified CDC best practices as part of our allocation decisions. We also refocused the board to not just include tobacco use, but also nicotine use. I know there's been conversation this morning, which is directly on point. We need to move to the next source of addiction, which isn't just the traditional tobacco cigarettes, but also vaping ends products. And the Act in 2392 allowed us to do that. Additionally, the Public Act 2392 set priority areas that the board would use in scoping out RFPs and competitive award processes for our basis. So that statutory framework was the basis of both the FY23 plan that you approved in March and is the basis for our FY24 plan before you today. Turning to the FY24 allocation, it recommends disbursement of the full unallocated balance of about $14.4 million. This is the single largest infusion of cash that we've put into cessation programs since the board was originally created in 1999. You may be surprised to hear that it's 14.4. So let me break down how we got to that number. 12 million was from a deposit made from the tobacco and health settlement in April of 24. Additionally, we decided to take inventory of all the legacy projects from prior iterations of the board that hadn't come to fruition or were underspent so that we could de-obligate them from DPH and put them back into the board. Those de-obligated programs are also part of this allocation. Finally, the board has been able to accrue some interest on the principal as it's been sitting there awaiting allotment. So the balance of about $1 million comes from interest accrued on the balance. That brings us to 14.4 million, which is the allocation plan before you. All 5 statutory categories are funded in our FY24 allocation plan. In putting the plan together, the board made 3 key decisions that I want to outline and explain to you now. First, we decided to take $2 million and make a dedicated investment to the quit line right off the top. This allows for another 4 years of funding for that important cessation intervention. Quitline offers free stop smoking services. Connecticut residents can access Quitline by calling 1-800-QUIT-NOW. They have access, once calling that number, to 24/7 live coaching, automated and in-person and telehealth counseling, online community support, and also access to free nicotine replacement treatments, as Commissioner Giuttani mentioned, gums, lozenges, patches. Why did the board decide to earmark $2 million right off the top for dedicated funding? 2 reasons. One, the CDC recommends that the largest portion of tobacco control money go to evidence-based cessation, and Quitline has the longest track record for actually delivering on helping people to quit smoking in Connecticut. Second reason is that we've heard a lot of the advocates stress to us the importance of continuous and predictable funding over a multi-year period. Sort of the starts and stops could be problematic, so we wanted to make an investment that was multi-year in the space of the Quitline. The second big decision that the board made was about priorities. The statute requires us to fund and consider 4 priority areas. That includes youth prevention, cessation across the lifespan, addressing secondhand smoke, including aerosols, and eliminating nicotine and tobacco disparities. The board, at our discretion, has the option to add additional priority areas when scoping out an RFP and awarding those funds. We had much deliberation, but we decided to adopt the statutory priorities without any additions because we didn't want to dilute those important priority areas. The third key decision was on how we would distribute and award the funds. As is past practice, the funds will largely be transmitted through a competitive bid process that DPH will oversee. There are 3 exceptions to this. One, which we already discussed, the Quitline is a dedicated allotment for a 4-year additional period. There's 3% of the allocation, which is going to be used by DPH for durational project managers and staff to oversee the RFP, contracting, and the oversight of our evaluator. And the final piece will be to fund the evaluator that's selected through our FY23 RFP process. We thought it was important that the evaluator we choose for the first round be continued and be the same evaluator throughout this second iteration, so that there's points of comparison and some consistency in that work. In closing, I would ask for your strong support for the FY24 allocation plan. It does have the unanimous support of our Tobacco and Health Trust Fund board members. It relies on evidence-based practices, including scientific evidence from CDC, as the commissioner earlier outlined. It honors all of our statutory requirements. It makes a commitment for the long-term sustainability of our Quitline program, and it dedicates dollars for independent evaluation to ensure accountability of all dollars used. Thank you for your consideration, and with that, I'd be happy to answer any questions.
Thank you. Are there any comments or questions? Representative Walker?
Thank you, sir, and thank you for your testimony. At first, there was a tongue-in-cheek comment you made where you said the advocates would like to have consistent funding and continuous funding so that we could address those issues. I think that comment is brought to us from every meeting we have, from every advocate. So I just want to say that's something that we all want and wish for. So thank you very much for that. In talking about the Quitline, I'd like to understand, do they keep the data on the people when they call, and do they do exit interviews to find out how they were connected to it so that we can actually see the value of it?
So your question is spot on, as always. Two things, how I would answer that is that in the earlier iteration of the board, Quitline was one of the consistent categories and services that we funded. And we can share with you as background the retrospective. So we had the University of North Carolina, Chapel Hill, do an assessment of each of the things that we invested dollars in, including Quitline. They identified it as being the most cost-effective and most impactful intervention. And we can bring back to your attention and share with the administrator the data that they found from the 2000 to 2017. They did a look at that stuff. Secondly, that's what makes me so excited about the allocation plan, is that for this round and the round that was previously approved by you all, we are going to have a dedicated independent person to do just that, collect the data and look at the ROI, try to quantify what works, what doesn't, how can we make it more impactful? Does the intervention need to be scoped, scaled, or shifted? So the RFP for the FY23 funds was just concluded. I really hope that that be a serious part of the investment moving forward, so that next time we could produce to you, here's exactly how much we put in, here's the data, here's who they served. But excellent points, and something we agree should be part of the work.
I thank you, because I think the ROI is really important going forward, because I think potentially we're going to see a lot of shifts in dollars and access to dollars coming forward, and making sure that we're doing it with the right direction and the right return, I think, is critical now. We cannot not do this anymore. We have to be very vigilant about that. And I did not see the report, but do you break out the percentages of the funding that is allocated for direct services, for marketing services, and then for administration of the tobacco fund? Do you break that out in your?
In the allocation plan?
Yeah.
The allocation plan only allows for 3% of the total to go to administration. So very lean in terms of how much is going to that. It's actually a CDC recommendation that we put some aside because we want to make sure that money moves efficiently into the community and to services, but we didn't want to over rely on that. So I think the 3%, it's less than the FY23 plan. We went from 4 to 3. We'll continue to see if there's room to save there so that we get as much of the money out to the community as possible.
But then the categories that we talked about, does it break it down to that?
Yes.
Okay.
Do you want me to, I can, for the record, if you want, read through.
If it's 4 lines or less, yeah.
Yeah, I think it's
Otherwise, I can
exactly
read it.
5. So
Okay.
state and
big,
community
okay.
interventions is roughly 4.3 million.
Okay.
Mass communications interventions are 1.48 million. Category 4 cessation interventions, this is the largest. It's almost 50% of the allotment. It's just under $7 million.
Okay.
And then surveillance and evaluation, a little over 1 million, and the balance for administration under 500,000 for DPH.
When you say surveillance, is that the vendors, the surveillance of the vendors and who they sell or solicit to?
Yeah, this would be the evaluator like University of North Carolina in the past that would look at each of the interventions we make, look at what impact is it making on the community based on the survey data, how many kids are smoking and or addicted to nicotine, and what have they done to sort of move the needle in addressing some of that? And how is the intervention focused on certain subpopulations?
Okay, I guess surveillance to me, a portion of that is administration, because it's telling us
Yeah.
what are we doing. So
That's fair.
when you said that, I said, oh, so that's how we categorize somewhere. How much money did we put in that?
A little over $1 million,
Okay.
1,115,000.
Okay, Thank you. Thank you,
you.
Madam Chair.
Up next is Representative McCarthy Vehy.
Thank you, Madam Chair, and thank you, Claudio. And you're smiling already because I know you anticipate the questions. Thank you for the answers to Representative Walker. I think it is important that we evaluate so that we know how to best invest the money. Yes, there are many of us who would like to see more of the tobacco trust fund monies go directly into this work, and that is part of the struggle of our esteemed appropriation committee to balance all of those needs that we have here in the state. But my question for you, as I did ask to the commissioner, is now that this group is up and running, do you see that there's capacity to be able to put, if there were more dollars theoretically available to do this work in order to prevent some of that money that we're spending on healthcare costs, do you see the capacity in the group? And if so, how would that work, especially with respect to the timing of the evaluation process?
With all due respect, and I'm saying this honestly, is I think it's too early to tell, right? We have not had an iteration of the board for over a 6-year period where we made no investments at all. The first round just closed for RFP November 1st. I think we got 12 bids. It'll be interesting to see which of those actually clear muster with the evaluation committee. So I think important question, but it's sort of work in progress TBD. And I think when we see what rose to the top and what we decide to fund and what balance may remain will tell us where there's community need and community spending. The other thing I would just say as we head into budget negotiations, I do think this cadence of having October be the report out is going to be more helpful for us, both at the executive branch level and working through the appropriations committee chairs and your legislative leadership on knowing how much money we need, how much is spent, and how it fits into the broader budget picture. I think it may be, earlier questions seem to suggest that we spend only 12 million on tobacco cessation. And I think we need to proceed with caution with that, because so much of the funding that we use to deploy for cessation is commingled with other programs. So in past years, when there were difficult budgets and it meant avoiding a deep cut in Medicaid, well, Medicaid has some significant cessation programs built into it for our Medicaid members. So I think it would be a little unfair to sort of look only at this one piece of investment and not look at federal block grant funding, Medicaid, other public health interventions, including some things with the insurance fund that has been supporting cessation activities, federal CDC grant dollars. So we should take a holistic interview, and I think the evaluator will help us do that.
I respect and appreciate that answer, and that's part of why I brought up the DEMIS funding, for example, because it's true, this is one piece of a much bigger picture. The second question that I have is related to the 10% of dollars that are allocated for the mass reach health communication intervention. And there's marketing so that people are aware that services are available. And then there are also social norm campaigns, which have been proven to be effective in a number of different areas related to substance use. For those 10% of the dollars, is that purely getting out information, or is there a piece of that that is also devoted to social norms?
Both, and I'm glad you brought that up, because I think changing the conversation, the culture around the coolness of smoking is just as impactful. So we intend to do both. Obviously, the Commissioner Giuttani mentioned cross-promoting other interventions like Quitline will be part of it. Just broad-based, the dangers of smoking will be another part. And I think anything we can do to use creative and innovative new media strategies to just change the perception around nicotine use will be part of it. Thank you.
Thank you for that. And I appreciate that you're doing both. Thank you, Madam Chair.
Thank you. Up next is Representative Paris, followed by Representative Kennedy.
Thank you, Madam Chair. I just want to turn our attention to something that may not be overly evident in this report, but I want to talk about the correlation in terms of the tobacco use with smoke shops that are opening across the state. In Stanford, I think it's like one smoke shop to every 2 people in the entire city. It almost feels like they're on every single corner. So we have seen a notable increase in the number of smoke shops in various communities. What impact do you believe that this phenomenon in terms of the tobacco use rates, particularly among the youth and vulnerable populations, will have?
Well, I think it's hard to tell just yet, but I think that we have put in place, because we're doing the community interventions, I think that's a place where we'll be able to see whether programming through camps, after school activities, so civic groups and organizations, if some of that can help combat the availability and the accessibility of lots of nicotine and tobacco shops opening up. And again, I point to the evaluator and the surveillance work that we're going to do, but something that I'm appreciative that you're putting on our radar screen so that we can look at it.
And I just venture out in saying that if there was any possible way that we can use a portion of the plans to fund advocacy around the enforcement efforts around the proliferation of these smoke shops opening, I don't want to cut out small businesses, but I do feel as though if there is something that is harmful to our communities, and we're hearing that high school students are using this frequently in school, and we see that, it's a problem for me to have a grocery store desert and a food desert than to have a smoke desert. So if we can actually use a portion of the funds for that, in targeting the proliferation of these smoke shops, particularly those who will take vulnerable communities, I think will be helpful and will counter some of the work that's happening. Thank you.
Thank you.
Representative Kennedy.
Thank you, Madam Chair. And thank you, Claudio, for your information. Representative Paris kind of hit on some of the things I was going to talk about, which is the number of smoke shops and vape shops that have cropped up. And although they were required to be a certain distance from a school, they're still within walking distance to a school. So I appreciate Representative Paris bringing that to our attention. And it is good to see you. I'm glad you're on the road to recovery. Anyways, my question really is we take in a certain revenue from sales of tobacco. Is that not correct? Through you, Madam Chair. I think it's roughly around 250 million plus or something of that nature.
There is a tobacco through you, Madam Chair. There are taxes on tobacco products. Yes.
Okay. And also you mentioned the recommendations of the CDC. It was my understanding the recommendation of the CDC is approximately 22 million. And I think what we're looking at right now is putting in 14.9 million. Am I correct in that thinking? Through you, Madam Chair?
Yes. So Representative Kennedy, we make proportionate changes based on the allotment of funding, but the CDC recommended percentages are aligned with what CDC recommends for an effective tobacco control substance. So yes, you're correct. The total dollar amount set aside through this type of intervention through the Tobacco and Health Trust Fund is not identically matched with the CDC. It proportionately reflects based on the amount of funding that is available to the Tobacco and Health Trust Fund.
Thank you so much for clarifying that. I realized I was not looking at the percentages. So thank you, Claudio, and thank you, Madam Chair.
Up next is Representative Dathan, followed by Representative Harrison.
Thank you very much, Madam Chair, and nice to see you today, Claudio. Just wanted to follow up a little bit with Representative McCarthy-Vahey's comments and talk about where Connecticut is in comparison to other states aligning with the CDC recommendations for our investment in programs for all of these things.
So, I mean, I think there's advocates here who are testifying who will probably tell you a lot more detail of where we benchmark nationally. I will say that, again, reiterating that there's so much of the funding in Connecticut is commingled with other very robust initiatives that we have that are unique to Connecticut. So it's a little hard for an apples to apples comparison. I will say, just for context, this year, if you guys approve this plan, you will almost double the amount of tobacco cessation money that came through the Tobacco and Health Trust Fund since its lifetime from 1999. So 99 through till last year, about 29 million. You guys have put in together would be around 24, 25 million. So you almost doubled it in 1 year. So I think we ought to take stock over how quickly and how significantly our investment in this space has been. Always there's objective targets that we should be striving for, and continuing to phase to become a leader among all the states, I think is a prudent thing for us to look at.
Thank you for that. I mean, I definitely, in looking at the YRBS results on tobacco use that was illustrated, definitely we see a decrease in smoking cigarettes. But I'm really looking at all of the vapor products that we've talked about today, where we are seeing an increase in those, and also the increase in other smokeless tobacco products. And I do have concerns that we need to do more to invest in our youth and in the prevention. I know I was part of the generation that really was, we shouldn't be smoking and these are the bad consequences, but I just don't feel that we're investing quite enough in our younger folks, because I do think, like others have talked about, if we can get to kids early and get them understanding why tobacco use is not good for long-term health, I think we can, using that investment, decrease the amount we're having to spend in other illnesses that are resulting from tobacco use, not just from the primary user, but from secondary users as well. And so I'm really curious to see, and I look forward to hearing from the advocates on where we stand as a percentage of the Tobacco Trust Fund. And like Representative Kennedy mentioned, the amount that we're taking in as revenues from those products. So thank you very much for your presentation, and I look forward to continuing to hear more as we get through the budget discussions.
Representative Harrison.
Thank you, Madam Chair. I think what I'd like to do is bring to our attention and maybe reiterate all the work that we did do as a board for the trust fund. They are anxiously awaiting the same data that you as a committee are looking for, so they can make better allocations. And we did, just from what we did know, make sure that we did continue to fund the quit line, because we know how important it is, and that we don't want people to call and be told that we don't have enough to support them. So hopefully we'll find that that works well, and we won't have any people feeling that they were left out. But I'd like to take the opportunity just to applaud the whole board. They really did go through their paces thinking about this. So thank you. That's just a comment. Thank you, Madam Chair.
Thank you. Seeing no other questions, I would just like to ask you if you are bringing back the surveillance and evaluation to the committee, the Appropriations and Public Health Committee, early in the budget season. Will you start getting some idea on that surveillance and evaluation, so that we can see what's going on? Because I think you heard pretty loud and clear that we wanted to actually have this start earlier. We didn't want to see 24 starting so late, meaning 25 starts late, meaning 26 starts late. So if we can readjust that, and then if you could get to us, I would say sometime in February or March, when we are making decisions, it would be helpful to understand the effectiveness of where the programs are. Is that a possibility?
Certainly, we're willing to do whatever is possible, working with our DPH colleagues that will own the contract for the evaluator. I think that might be a little bit aggressive, given that there won't be any programs in place for them to evaluate yet. So the RFP that's concurrent with the evaluator, to select the evaluator and to select the programs that are going to be funded with the original 12, is still under review. It closed November 1st. However, what we can commit to do, and I think Representative Harrison alluded to this, is the board has been aggressive in terms of our next agenda items will be to bring people back in, like Quitline. So we're going to have the new provider of Quitline at our January meeting, and we're going to be able to ask them for what is how many people do they serve, what's their impact, and try to get data one by one. So every project that we do have funding for, we're certainly willing to bring back and help quantify the data that they can produce for us as a temporary way to fill in that gap until the evaluator can be put in place.
Hold on a second. Representative Reddington Hughes, are you here? Do you have a question?
Thank you, Madam Chair. Thank you, Claudio, for all the work that you're doing on this. My question has to do with what metrics actually will be used to measure the effectiveness of the gum, the patches, the therapy, the lozenges, all of these cessation methods, so that the most effective methods can be used going into the future.
Yeah, that's a fantastic question. And that's essentially why we felt the need to have an independent evaluator who knows this space really well to help us come up with measures, metrics, and what the outcomes can be. Just as a layperson, I mean, I'd like to see us have lower risks of smoking. I would like to see the youth surveys that we do in the schools to show some progress and movement away from some of the vaping, especially for our youth. So I think the survey activities for DPH would be the first good spot to look for if we're making impact, but certainly look to the academic evaluator to help us do that framework.
I'm just curious with the quit line, is there a follow-up? Is there somebody who, somebody calls the quit line and they are put on to a different cessation method? Is there somebody that follows up to see if this person is improving, if they have now quit smoking? How long has it been? Are those any of the questions that they ask?
Yeah, so my hesitation in answering is that we are, as mentioned earlier, we're transitioning to a new vendor. So I don't want to get ahead of what the new program is and give old, outdated information. But what I will commit to do is when they come and present to us in January, we will send by way of follow-up the slide deck that they present to us on the new vendor and what their program looks like. And then at least you'll have some background of how it'll look moving forward. Does that work?
Thank you.
Thank you.
All righty. Seeing no other questions? All set, you're all set. Up next is Jim Williams. Mr. Williams, are you here? You've got to turn on your mic. There you go.
Good afternoon. My name is Jim Williams. I'm the Government Relations Director for the American Heart Association in Connecticut. I would like to thank the leadership and members of the Appropriations Committee and the Public Health Committee for providing me with the opportunity to make comments today on the Tobacco and Health Trust Fund allocation. As you heard earlier, tobacco use is still the #1 cause of preventable death and disease in Connecticut. Despite this fact, today marks only the second time since 2015 that the legislature has had an FY Tobacco and Health Trust Fund allocation plan to review. The legislature approved $12 million in 2022 and again $12 million in 2023. The $12 million approved in 23 is what we're here discussing today. We feel strongly that any allocation plan should closely follow current CDC best practices as they are tried and true actions in preventing and reducing tobacco use. We feel that the allocation plan before you today successfully addresses those goals. However, as you may recall from last session, the governor's proposed budget initiated a temporary pause for this annual funding, and when session ended, there was no new funding approved. Any successful program relies heavily on continuity of funding, which is why we cannot simply allow these funds to be swept again back into the general fund, especially now that the program is finally getting back up and running. A comment was made earlier today that funding this annually is problematic at best. I would argue that it is problematic only if we make it so, and here's why. Tobacco control in Connecticut should be viewed as self-funding, as Connecticut takes in approximately $450 million, 83 million approximately from the Master Settlement Fund, and $367 million approximately from tobacco sales revenue every single year. The CDC recommends that at a minimum, Connecticut invests $22.7 million annually on tobacco control and ideally invest $32 million annually. I'm hopeful that the governor's office will put this critical funding into their upcoming proposed budget and that the legislature will support it. Thank you very much for your continued support, thoughtful consideration. I'd be happy to answer any questions that you may have either now or later.
Thank you. I don't see any questions for you. We're all set, sir.
Thank you.
Up next is Ruth Canovi. Ruth?
Hi, good afternoon. Dear distinguished chairpersons and members of the Appropriations and Public Health Committee, my name is Ruth Canovi, and I'm the Advocacy Director for the American Lung Association in Connecticut. I really want to thank you for the opportunity to express our support of the Tobacco and Health Trust Fund Board's recommendations for allocating more than $14 million in funding for tobacco cessation and prevention programs. It really is exciting to see Connecticut investing in a state program to combat the leading cause of preventable death and disease in our state, and at levels we have only just started to see. Now, despite being less than half of CDC's best practice recommended $32 million annually, these funding levels allocated in fiscal year 2023 and 2024 are at levels we haven't seen in the past. And to be clear, this is a big step in the right direction. The request for proposal deadline, as you've heard, for the fiscal year 2023 plan you approved in March, just passed on November 1st, and we're looking forward to seeing this funding in action. The next round of funding is again on the right track, and I want to commend the Tobacco and Health Trust Fund Board for their commitment and thoughtful way they've come to these recommendations. Following CDC best practices is a valuable and important strategy. And as you've heard, advocates have long expressed the importance of an evidence-based, robust, and sustainable approach to this work, as continuity of funding really does help ensure continuity of services. I appreciate the board's extra attention to the quitline services, given the challenges that we've already seen to the funding available. I support this extra boost to the state quitline at this time. However, I do caution against planning for sustainability with the strategy of planning for continued cuts to this funding. As many of you have heard for decades, this funding comes from the 1998 Master Settlement Agreement with the major tobacco companies, which runs in perpetuity until tobacco use is ended for good. Moving forward, we certainly should be able to plan for continuity of services using less than just 10% of that total revenue from tobacco taxes and the Master Settlement Agreement to ensure we have help people addicted to tobacco quit, and to help prevent kids from getting addicted to these lethal products in the first place. As you've heard, this investment to prevent young people from getting hooked and helping those already addicted to quit, in addition to saving lives, actually does save money. So I appeal to you to approve these recommendations and encourage the Tobacco and Health Trust Fund Board to keep up its diligent and thoughtful work. Please don't let bureaucracy set us back in the sustainability of the community programs that are about to be funded. Last legislative session's budget suspended the transfer that will take place in 2025 to this fund. I have real concerns that now there is a plan for these funds in 2025 to go somewhere else. It will be a real challenge to get these funds back towards tobacco cessation and prevention work. This should be an easy, common sense policy. We invest in the health of our communities with the money available from a settlement with the industry to do just that. This investment not only makes good public health sense, but it is also good fiscal policy. Thank you very much.
Thank you. I see no questions for you. You are all set. Oh, we don't normally do questions with these people. What do you want? Go ahead.
Thank you, Madam Chair. I appreciate that. Ruth, thank you for your testimony. Do you happen to have numbers related to state healthcare costs for tobacco use as opposed to national costs?
I would concur with the comments that I heard already today. It's more than $2 billion to the state every year.
And that is a state number. I meant to clarify.
Yes.
The commission.
It is a state number, not a national number.
Okay, if you could provide us with some background documentation for that.
Yeah, absolutely. I'll follow up with the committees today. Yes, thank you.
Anybody else now that we've opened up the door on this? Representative McCarthy Vahey, trying to get to the next piece. Seeing none, we are going to close the public hearing, and we are going. Madam Administrator, let us know when you're all set to start the. All set. We're going to go to we're going to open up the meeting agenda for the allocation plan for the 2024 Tobacco and Health Trust Fund allocation plan. Representative McCarthy Vahey.
Thank you, Madam Chair. Madam Chair, I'd like to, I'd like to convene the meeting related to the fiscal year 24 Tobacco and Health Trust Fund allocation program. I would ask for, and Mr. Clerk, I just want to make sure that you are all set and ready for us to go. Okay, great. I would ask for a motion from one of our Public Health Committee members.
Second.
And seconded by Senator Anwar. Is there discussion on the item? Seeing and hearing no discussion, Mr. Clerk, if you would call the roll.
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Rep. McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Claridis Detria, Representative Belton, Representative Berger Gervalo,
Representative Berger Gervalo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Jenga, Representative Chris,
right? I mean, are there some biases against individuals who are recipients of a housing choice
You are not speaking. Please mute yourself.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Kavros DeGraw,
Kavros DeGraw votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Linehan,
Representative Linehan votes yes.
Representative Mara,
Representative Mara votes yes.
Representative McCarty,
Representative McCarty votes yes.
Representative Palm, Representative Perillo, Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Representative Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Terziak, Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
and then I'll go through the list again. Representative Claridis Detria,
Representative Claridis Detria votes yes.
Representative Belton, Senator Cabrera, Representative Carpino, Representative Dauphiné, Representative Denning, Representative Elliott, Representative Jenga, Representative Palm, Representative Perillo, and Representative Terziak.
Hello?
Representative Dauphiné.
Yes.
Got you. All right.
Thank you, Mr. Clerk. We'll give you a moment to take the tally. And then if you would please announce the tally.
Twenty-eight total voting, 28 yay, 0 nay, 0 abstain, 9 absent not voting.
Thank you very much, Mr. Clerk, and Public Health Committee is in recess.
Thank you, Representative McCarthy Vahey. The Appropriations Committee convenes the meeting for the FY '24 Tobacco and Health Trust Fund Allocation Plan and entertains a motion. Moved by Representative Exum, seconded by Representative Dathan. Is there any discussion? Seeing no discussion, Madam Administrator, if you could call the roll, please.
Senator Austin.
Senator Austin votes in the affirmative.
Representative Walker. Senator Hartley. Representative Exum.
Representative Exum votes yes.
Representative Paris.
Representative Paris votes yes.
Senator Berthel.
Good afternoon, Madam Administrator. Good to see you. Senator Berthel votes yes.
Thank you, sir. Representative Nuccio.
Good morning. Representative Nuccio votes yes.
Thank you, ma'am. Senator Anwar.
Senator Anwar votes yes. Senator Anwar votes yes.
I gotcha.
Okay.
Representative Baker.
Representative Baker votes yes.
Representative Belinsky.
Representative Belinsky votes in the affirmative.
Representative Callahan. Representative Callahan, are you with me? I know you're there. I'll come back to you. Representative Candelaria.
Candelaria votes yes.
Representative Chalesky.
Representative Chalesky votes yes.
Representative Curry.
Representative Curry votes yes.
One more time, sir, so I can see you.
Yeah, Representative Curry votes yes.
Thank you. Dathan.
Yep.
Representative DiCaprio.
Representative DiCaprio votes yes.
Representative Delaney.
Representative Delaney votes yes.
Representative Delnicki. Representative Dillon.
Representative Dillon votes yes.
Representative Felipe. Senator Flexer.
Senator Flexer votes yes.
One more time for me, ma'am, so I can see you.
Senator Flexer votes yes.
Why am I not seeing you? Try one more time for me.
Senator Flexer votes yes.
Can you see it?
May, your video is not on.
No, because she's got everything on.
It's not showing up on mine either.
Senator Flexer, I'm going to come back to you, so don't hang up yet.
Okay.
We've got some sort of technical issue. All we have is a dark screen for you.
I see that.
Representative Paris said there was an update last week that knocked off people's cameras, so she may need to go out and come back in.
That's what's Representative Fonsello, whom I'm about to call on, had that same issue this morning. So thank you.
Do you want Senator Flexer to go out and come back
Yeah,
in?
Senator Flexer, what I would suggest, and we won't announce the tally until you come back on, why don't you just log off of everything, restart your computer, and then log back into Zoom?
Okay, thank you.
You're welcome. And now it is a pleasure for me to say, because I can see Representative Fonsello.
Fonsello votes yes.
Thank you, sir.
Thank you.
He has had terrible technical issues today. Representative Garabay.
Garabay votes yes.
Representative Gibson.
Representative Gibson votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez, Representative Haddad,
Representative Haddad votes yes.
Representative Hall, Representative Harrison,
Representative Harrison votes yes.
Representative Hoxa, Representative Johnson,
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser,
Senator Lesser votes yes.
Senator Marks,
Senator Marks votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
Senator McCrory votes yes.
thank you, sir. Representative Nolan,
Nolan in the affirmative.
Representative
Representative Porter votes in the affirmative.
Representative Osborne,
Representative Osborne votes yes.
Representative Reyes, Representative Rosario,
Representative Rosario votes in the affirmative.
Representative Rutigliano,
Representative votes yes.
Representative Ryan,
Votes yes.
Representative Sanchez, Senator Slapp,
Senator Slapp votes yes.
Representative Sims,
Representative Sims votes in the affirmative.
Senator Summers,
Senator Summers votes yes.
Representative Tersiak, Senator Winfield,
Senator Winfield in the affirmative.
thank you, sir. Representative Zawistowski,
Representative Zawistowski votes yes.
thank you. Representative Felipe,
Thank you. Representative Felipe votes yes.
thank you, sir.
Senator Hartley is on now too.
Okay, yeah, I'm coming back to people. Senator Hartley,
Senator Hartley in the affirmative. Thank you, Madam Administrator.
thank you, ma'am. Representative Callahan,
Sorry, technical problem, Sue. Representative Callahan votes yes.
thank you, sir.
Yes, we can recess for a couple of minutes until she comes back. We'll recess until the time she comes back on. How's that? Essentially done, but she.
Hi, Senator Flexer, I can see you now.
Hi, I just decided to use a different device and I would like to vote yes.
Thank you, ma'am.
Madam Administrator,
I just
Madam
want-
Administrator, when you're ready, please let me know the tally.
Yes, ma'am. I just want to double check if there are any members of the Appropriations Committee who have not yet cast their vote who would like to do so at this time. Hello.
Go ahead.
So number voting 47, those voting yea 47, those voting nay 0, those abstaining 0, those absent not voting 6.
How many were absent?
6.
Thank you very much, Madam Administrator. The motion passes. I'll entertain a motion
So
to
moved.
adjourn made by Representative Walker, seconded by Representative Nolan. All those in favor and appropriations indicate by saying aye.
Aye.
We are adjourned. I will pass it over to Public Health.
Thank you very much. I reconvene the public health meeting and I'll accept a motion to adjourn the meeting.
So move.
Moved by
Second.
Representative Berger Javallo, seconded by
Second.
Senator Amor. Was that Senator Amor? Great. Thank you. We are adjourned.